Welcome and thank you for joining today. Our press briefing, which gives us the opportunity to communicate about very important subjects across our state, whether it's COVID-19, the economic recovery, or any other serious conversation we need to have. We appreciate those who tune in and those who are here to engage. The first thing I want to address is the uptick in cases in coronavirus and COVID-19 cases, positive cases in our state. In the last week, we've had an uptick of those cases. It's not unexpected, given that folks are out and about much more, moving around our state. It's very important that we follow this information, this data, not only the cases that we have in our state, but the very important data point of hospital capacity. And fortunately, our hospital capacity is very stable in spite of this uptick of cases, but we will continue to track that and make sure we monitor that important data. I also want to encourage Tennesseans that one of the reasons we got to a place where we're to the place that we could open our economy in a greater way, one of the reasons is because Tennesseans did what helps to mitigate the spread of a virus like COVID-19, washing hands, staying home when sick, getting a test, which is incredibly important for Tennesseans to remember, wearing a mask. And we have continued distribution of the free masks that we provided. The EPA, as you know, has reported and made sure that we all know that those masks are safe for Tennesseans, so we've begun the redistribution, the continued distribution of those masks. But all of those things, social distancing measures that Tennesseans have taken, have allowed us to move forward in this environment of an opened economy. It's incredibly important that Tennesseans continue to do that, continue to follow those practices so we can mitigate the spread of this virus and manage and maintain it as we go through the summer. A couple of other things we're going to talk about today are nursing homes in Tennessee. We're going to talk about support that we're providing for Tennessee businesses and continued efforts to ensure that our minority communities receive the testing and the treatment that is necessary in the midst of this pandemic. Our nursing homes and our long-term care facilities have been closed to outside visitors since March. This measure has been necessary in order to protect the most vulnerable of our citizens, the elderly, and for whom this virus has been particularly cruel. At the same time, it's created a tremendous hardship for those residents and for their family members because they've been unable to visit with one another, friends and family, for almost 3 months. Every nursing home and long-term care facility resident will have been tested by this Friday, and we have been working with, and I'm very grateful to the nursing home and long-term care facility industry for working with our health department to not only get the testing done of the residents, but to ensure that we have a process for repeat testing for staff members in those facilities all across the state. Our Unified Command Group has worked very closely with this industry to take the steps necessary to provide safety for the most vulnerable in our community. But today I signed an executive order that will allow these facilities to again open their doors to visitors starting on Monday, June the 15th. We've set expectations that specific safety protocols will be followed, because while we want to provide for an opportunity for visitation and for family members to once again reconnect with their loved ones in long-term care facilities, we can't ignore the fact that these are our most vulnerable citizens, and so there will be strict safety protocols put in place. At the same time, we do want to open up those facilities for visitation. Dr. Pierce is going to give more information about what safe visitation actually looks like in a few minutes when she gives her report. And if you are planning to visit your loved ones in a nursing home, I encourage you to show grace to those facilities who are having to make dramatic changes in a very short period of time, because we wanted to make sure that folks could have access to their loved ones, but we're grateful for the hard work that those facilities are doing. This is one of our most vulnerable populations, and we all have to work together to make sure that we protect them. If you are going to visit as well, get a test. You know, testing, and I'll say this over and over again, testing not only provides you information about your own health, but it actually provides the state with information that understands where cases are and therefore where spread happens, and it really provides protection for your neighbors as well when you get a test. So particularly if you're going to go back into a nursing home facility, please get a test. Individuals have taken advantage of voluntary free testing throughout this pandemic. We have worked really hard to make testing widely available because we know that that's one of the most important things that we can do to fight this virus. But I want to call on Tennessee businesses today. We invite employers, especially those of our larger facilities, manufacturing facilities, large numbers of employees, to work with us to coordinate pop-up testing facilities for your companies and for your employees. Again, it helps all Tennesseans when any Tennessean gets a test. And as more employees return to work, we want to work with employers to have those employees tested. Last week, state employees began to come back to work in their office place, and we offered testing to state workers. We want to do the same thing for industries all across the state. So our Unified Command Group can work with any employer that wants to set up a pop-up test for their facility. Information is available on our website, and we encourage employers to engage in that. Throughout the pandemic, we have repeatedly seen how COVID-19 has exposed particularly barriers to minority communities, and we've made a great effort to be thoughtful in our approach to providing materials in our health departments in multiple languages, and to engage trusted community partners so that we can provide more access to more people all across the state. Last month we worked with housing and urban development agencies in our major metropolitan areas, Memphis, Nashville, Chattanooga, Knoxville, to provide free voluntary testing to residents right in their neighborhood, particularly in an effort to serve folks who might have transportation barriers. We want to continue to build on those efforts and continue to build partnerships. I want to make a special shout out and express gratitude, especially to churches in Memphis who are actually working together to create a large testing event this weekend. Our faith communities have played an important role and continue to do so, but we're grateful for their work this weekend to especially provide more testing to the communities that they are in. We're also working with our federally qualified health clinics across the state to make sure that we provide access to more testing for our minority populations. Kimberly Lamar from our, Dr. Lamar from our Department of Health's Office of Minority and Health Disparity Elimination is with us today, and I've asked her to come up and say a few additional comments about our efforts to reach all Tennesseans. Dr. Lamar.
Good afternoon, and thank you, Governor. During this heightened time, as we pursue justice and as we work to rebuild and recover, it's more important than ever that we maintain health in our communities. The impact of COVID has been significant on minority communities, particularly our African American communities and our Latino populations. Particularly as the heightened work that has evolved and that is needed as a result of many conversations that have been held across the state. It is pertinent that we work to ensure that health is equitable, accessible, and attainable for all Tennesseans. The Department of Health is committed to doing this work, and we are also committed to addressing and advancing health equity. Over the past 6 weeks,
I want to make a couple of comments before I ask Dr. Piercy to give her report on economic recovery. I have a lot of optimism about a lot of things in our state. We are in a process of transformation, and that's a good thing. And one of the things that is happening right now is our economy has been opened back up and is beginning to recover. And our economic recovery group has been tracking recovery, and part of the way they do that is by communicating with businesses across the state. So they survey a number of businesses about what's actually happening in their companies and with their employees to try to gauge and understand just what's happening on the ground in our economy. The economic recovery group fielded a survey, and they shared some of the highlights of those, and I'll just give you a couple of points that were encouraging. They asked businesses if they have been unable to generate revenue. Are you currently unable to generate revenue? And the businesses that report that they were unable to generate revenue dropped in a 1 month period, because we've done this survey twice, dropped from 27% of those reporting a month ago that they could not generate revenue to 12% today. That's movement in the right direction. Many more of our companies are back in business and generating revenue and beginning the process of providing opportunities for jobs for folks. The percentage of businesses that are reporting no layoffs or furloughs has increased this month to 64%. So 64% of the over 6,000 businesses that responded to our survey said that they were reporting no layoffs or furloughs. So our unemployment numbers are improving. It's very challenging, as we all know. Many Tennesseans are out of work, and that's been a difficult situation for sure, but we're moving in the right direction, and that is very encouraging. Also, the majority of Tennessee businesses that were surveyed said they knew about the Tennessee Pledge and they were able to comply with it. That was encouraging. We remain encouraged that in spite of this tremendous health crisis and economic crisis, we have better days ahead for us as a state, and encouraged by that economic report. Dr. Piercy, would you please come and give us a health report?
Thank you, Governor. Good afternoon. Today's numbers will be out within the hour, so these are yesterday's figures, but the total case count was 27,575 with 9,127 active cases. We have now done over 500,000 tests, and that number continues to grow each day. As the Governor mentioned, I want to spend most of my time today talking about the nursing home visitation guidelines. As he's mentioned, and as we have said just countless times, it is the most vulnerable population. The devastation that occurs when one of these individuals, a resident in a nursing home or a long-term care facility, gets infected is incredibly critical, and it's absolutely much worse than if those in the general population do. And so restrictions are important, but social and emotional well-being is also incredibly important. As he mentioned, the last few of the long-term care facilities are being tested this week, and so that will complete all of the testing statewide. And then beginning no later than July 1st, and some facilities have already done it, then the staff will begin weekly retesting in nursing homes on a forward-going basis. As I mentioned, our top priority is safety of both the residents and the staff, but we want to balance that with their social, emotional, and psychological well-being. So we are announcing the opening next week of limited visitation. Facilities will have to meet some requirements to do this. They will be located in counties with lower disease burdens. They have to agree to meet the prerequisites that are defined by our guidance and agree to the restrictions and screening protocols of those that come to visit. We are going to be allowing 3 options for visiting. One is outdoor visitation with proper distancing. Another is indoor or outdoor visitation with a visitation booth. Most commonly, that's with a plexiglass barrier. And then finally, there are some very limited yet available options for in-room visitation, because we do understand that there are some residents that aren't able to physically tolerate the other 2 options. So you'll see that guidance forthcoming pretty soon. For facilities, I will reiterate exactly what the Governor said is, please give these facilities some grace. They have been under very strict restrictions for the last several months, and it's going to take them several days or perhaps longer to be able to comply with our strict guidelines. And I do acknowledge that these are quite restrictive, but that's okay, because we need to be able to do everything we can to protect this most vulnerable population while allowing for their social and emotional well-being. Secondly, I also want to reiterate his comments about we have seen a slight uptick in our case count. This is not unexpected. People are moving about, and we knew this was going to happen, but we're watching it very closely. Fortunately, our hospital resources are stable and are forecasted to do so. And we are in continual conversations with the Tennessee Hospital Association and many of our providers statewide just to make sure we have good eyes on what those resources are. As a reminder, just because we're moving forward, don't forget the basic tenets. Distance yourself, stay at home if you're sick, wash your hands, and wear your cloth face coverings. And finally, I just want to reiterate our continued focused efforts on communities of color. I appreciate Assistant Commissioner Dr. Kimberly Lamar, whom you heard from earlier, as she explained our efforts to increase and expand access to testing as well as wraparound services. Our department continues to engage in culturally appropriate manner, and our commitment to confronting racism and eliminating disparities is not just a focus during this pandemic, but it's for the long haul. Thank you.
Thank you, Dr. Piercy. And thank you all again. We'll open up to questions. I want to remind you that Dr. Piercy is here for questions, Dr. Lamar, General Holmes with Department of Military, Director Sheehan with TEMA. I see Penny Swin back there with Department of Education in case anyone has questions there as well. So we'll open it up to questions.
Governor, the legislature has now passed a bill that would basically say that you don't have to sign a Presidential Day proclamation. It's not the same as what you had proposed, which would have eliminated the day in its entirety. Given the national climate and everything that's going on, are you satisfied with that, or does this not go far enough to just say the governor doesn't have to sign the day?
You know, I think we're in a place right now in our country that's unique. This country has, I'll just say broadly before I specifically answer your question, the country has, since the signing of the Declaration of Independence, this country has been in a process of transformation from day one, ever moving toward a more perfect union, and we're still in that process. And in the last few weeks, we've had an elevated conversation, certainly around the racial reconciliation and disparities, and that progress, while we've made a lot of progress, we have a long way to go. And that progress needs to be accelerated, and we'll take steps in that direction. I want to be a part of that process. This bill that lessens the height of the proclamation of this particular day that's particularly painful to African Americans, that's an important step forward. I'm glad that they made it.
Do you think it goes far enough?
I think we're in a process. I think we're in a process in this country, and I'm grateful for steps in the right direction.
Governor, most of this is we have heard Black legislators in meetings, talking to reporters, pleading for their white colleagues to take stronger action on issues of racism. And in most of those cases, they feel like their calls have fallen on deaf ears, that their colleagues in the journalism just don't understand. They're not willing to do some uncomfortable things. From your perspective as governor, is there a problem with racism in the Tennessee General Assembly, and what do you plan to do as leader to show decisive stance against racism?
You know, I think that it's really important that we have more dialogue and not less. And so quick, we're so quick to draw lines and choose sides, and dialogue stops when that happens. And so any Tennessean, and I think it's been especially made aware even in the last several weeks, that we all need to engage in more dialogue. I think we've had a lot of opportunity in the last few weeks to have dialogue, to learn from one another, and I believe we have an opportunity for movement in the right direction. As I said, this country has never stopped in its movement in the right direction. And we cannot stop now. In fact, we should accelerate that movement in the right direction. Dialogue, whether it occurs in the legislature, in the public square, and I know for myself, having conversations with my family, with my friends, with law enforcement, with black leaders across this state, dialogue has taught me that there are no complicated answers. I mean, there are no easy answers. The answers are complicated, but it doesn't diminish the value of those dialogues that will actually allow us to move forward. That should happen. It should happen on the floor of the legislature. I think there have been examples where it has happened in the legislature, even this past week. But I would encourage all of us. We're in a place in America that we're in a unique spot. We're not in a unique spot in that change is happening because it's been happening since we began as a nation, but we're in a particular spot where a particular issue has been elevated, and we need to have more dialogue around that. And I look forward to being a part of that.
You mentioned the need to accelerate some of this progress because it is a process. There's going to be a large gathering of people outside the Capitol today, once again calling for the bus to come down. Are you ready to call for the Forest bus to come down at this point?
Yeah, you know, I've spoken on that issue before, as you've asked me. You and I have talked about it, and Chris and I have talked about it. Multiple folks. I've said before, something should be done there. It's a part of the need for greater dialogue. There are no easy answers. There's no quick solutions. I've said at the very least we ought to provide context. It isn't my decision, but I want to weigh into that. The Capitol Commission ultimately decides that. And, you know, we've made some progress. We appointed new folks to the Capitol Commission. Kind of that whole process got derailed by COVID. There's now a vacancy on that. I'll reappoint that vacancy, and I expect that commission will be meeting in the coming months. But on the subject broadly, just like the Nathan Bedford Forrest Day, Nathan Bedford Forrest is a particular individual whose role in history is particularly painful for African Americans, and therefore we should consider things around that individual uniquely, I think, including the bus.
So would you advise the Capitol Commission that you prefer to come down?
It's not my role to advise the Capitol Commission, but I certainly can make comments and will be over the time about how I feel about it.
Sir, thank you. Governor, good to see you. You talked about dialogue. You also mentioned racial reconciliation. Those are very well worded concepts, but I wanted to ask you, I mean, the reality is that we've been having this dialogue on racism, institutional racism, systemic racism for years, for decades, and nothing has happened. And so, as the leader of the state, you could eventually provoke change besides just dialogue.
Yeah.
Is there anything tangible you're planning to push, or your administration is planning to push, besides listening to the Black community and the Latino community and all the minorities in this state?
Well, I think opening up dialogue brings about change, and I think listening, intentionally listening, creating venues, meeting with law enforcement and community leaders to talk about law enforcement and the relationship between law enforcement and community leaders. Those are actionable steps. So increasing dialogue will bring about an accelerated transformation on the issue, for example, of racial reconciliation. I actually think that's a very substantive thing to do, and I plan to do so in the weeks and months ahead.
What does racial reconciliation means for you, and how do we achieve that?
I'd answer that by saying, based on the last few weeks of my life, reconciliation for me will be defined by listening to those who are most involved in racial reconciliation and understanding what it means to them. That's gonna help me in knowing how to go forward. I think being aware that my experiences only define my view, but others' experiences will help inform my view, and that's how I'll approach this.
I have a Commissioner, you talked about how the state was expecting an uptick as we reopen business in the state. You're talking about you're going to be monitoring this number. Is there a scenario where you see that maybe that uptick could get out of control, and then what would we be doing to address that, or to at least prevent that?
Sure. I think that's something that's on everyone's radar, and so we're watching it very closely. But I'll point you back to something that I remember. It was in this very room we floated the concept early on of flattening the curve. And flattening the curve is all about hospital resources and making sure that we have enough assets and capacity in our healthcare system to take care of any surge that might occur. And so that's the primary metric that we're watching. As I mentioned, it's completely expected that the case count would go up, but I would caution you to not take that in singularity because you have to put that in the context of hospital capacity.
Along the same lines as the previous questions concerning racism and even benefit force day plus, Governor, what would you say directly to these people who are going to be out here in Legislative Plaza in about 90 minutes? And a simple call, remove that bus. And they know that you can, like Governor Haslam, put a petition before that Capitol Commission. Are you going to do that? And what would you say to those folks out here?
You know what I'd say, Chris, is I've learned over the last few weeks that my views need to be informed, especially on very important subjects that impact the lives of Tennesseans. And if I'm going to make a decision around something that is as controversial and that has as much negative impact in the minds of many African Americans as that issue does, then I want to have dialogue about that before I make a quick statement about what I think should happen. It's very easy to, and it's very tempting, actually, to find an answer overnight to very complicated issues that have been hundreds of years in the making in our country, and I'm not going to fall into that temptation.
What's stopping you from acting, and who would it hurt by removing that bus?
I've said this is a process, and I'm going to follow that process, and that process is movement in the right direction, and it's listening, and I intend to do so.
And one quick follow-up, just if I may, on unemployment. There's been nearly 600,000 people who filed since early March. Do you have a sense of how many people have gotten back to work of that number?
Yeah, I can't. I would have to get that from Department of Labor specifically. Certainly our unemployment new claims files have fallen week after week for I think the last 9 weeks, which is a very positive movement, which means people are going back to work. But I can't answer that question directly, but I can get you that information. Our Department of Labor would have that information.
I've been trying.
I'll get it for you.
Thank you.
It would be a projection, right? Because we don't know exactly who has or has not. A lot of that depends on their reporting or their claiming unemployment. But we certainly can make some projections there.
There should be a projection.
You've got about $4 billion in reserves right now, and planning to add about $575 million over the next year and a half or so, 13 months, really. How bad really is the state's economic situation? I understand you have the sales tax shortfalls. How bad is the state's economic situation really if you have $4 billion now and getting ready to add $575 million, even when you're taking revenue from here and there and trying to fill all these budget gaps?
Yeah, I'm not sure what your $575 million is.
$375 million or so to the rainy day fund.
Not in the new budget. So let me tell you how bad the state's economic budget is. It's a $500 million shortfall to close out this year, $500 million, and it's projected to be $1 billion in next year. in a state budget, $1.5 billion shortfall is a major challenge for us. It will require department cuts. It will require eliminating all of the increases that were placed in the budget before. It will require tapping into reserves that we have in different departments all across the state. It'll require a very disciplined approach that I feel very confident that we can make going forward, and that is in part what our reserves are there for, and they will be used.
But David Berman said the other day that you're planning to get up to $1.2 billion on the rainy day fund, and then adding another $250 million at the end of next year.
Yeah.
That's adding $575
Now, I'll go offline go over that budget issue with you, but we're making significant reductions in previously planned spending, including cuts in every department, and actually tapping reserve funds to make up the deficit, not add to those reserve funds.
Andy?
Governor, getting back to the Renfro masks, Commissioner, you all talked about conducting drone tests before making a decision. Did you all conduct drone tests, and with whom, and what were those findings?
Dr. Pierce, you want to answer that?
Yeah, related to the Renfro mask, we did initially pursue some independent testing, primarily because we didn't believe we would actually hear back from the EPA in a timely or directed manner. We were pleasantly surprised earlier this week to get a full report of safety from the EPA, which we consider to be the gold standard on those different chemicals, and so we have canceled our independent testing and are endorsing the use of those masks.
And what would you, Chattanooga Mayor Andy Burke has got 20,000 masks that he's withholding distribution of right now. What would you tell him right now?
We've instructed our warehouse to go ahead and continue with distribution of those, and we would give him the same encouragement. As we've already mentioned, as we're seeing case numbers go back up, cloth face coverings of any kind will be highly advisable, and so if he's got those sitting there, they need to get out in the hands of the public.
Dr. Pearson, before you walk off that one, what is the hospital capacity rate at right now? Do you have a number on that? And do you attribute any of the rising numbers to protests or gatherings of that size?
So to answer your question about hospital capacity, this morning inpatient and ICU availability was both at about 20% of state capacity. If you'll compare that to when everything was closed down and elective procedures weren't going on, that was in the 24 to 26% range. So we have seen the expected decrease in capacity related to the increase of elective procedures, but that is still well within reason as far as statewide capacity. Related to your question about case count increases related to the protest, we haven't seen any kind of specific trend that we can link to that generally, more so around the increase in movement of people, particularly starting around the Memorial Day holiday, and have started to see that, which also does coincide with some of the protest activity, so we can't make that direct link.
Thank you. Governor, you're in the office. There's so many ideas on criminal justice reform. Do you think that this is the time to change some of the willingness to tackle that in the General Assembly? Do you sense that changing? And Nashville has had a long struggle trying to get body and dashboard cameras. Would that be something that you might look at putting a little funding into statewide to continue to spread that as an accountability piece for law enforcement?
I think the issue of criminal justice reform is, it's really important. It's been important to me. It's actually important to the General Assembly. As you know, the legislation that we proposed on criminal justice reform was in the process of making its way through the legislature and committees. It had fiscal note, it had cost attached to it, and so we made the decision to, as we did with the majority of issues that had cost associated with them because of the economic challenges that we face, we made the decision to withdraw that. But I was very encouraged about the progress we made, and I expect that we will make even more progress in that vein going forward.
Thank you. Final question.
Yes, sir. Alexander Willis with the Williamson homepage. Thank you, sir, for your time. So on Monday, the Williamson County Commission, they discussed what the process may look like of altering its county seal, which bears the image of the Confederate flag. Now, they learned that the Tennessee Historic Commission, body that you yourself sit on, Governor, would ultimately have the final say on whether or not that would be allowed. Yeah. So, were the county commission to pursue altering the seal, would you, as a city member on that commission, support allowing the Williamson County Commission to alter its seal?
Yeah, I don't know about that process. I haven't looked into it. I think that the most important thing that community can do, just like any of these topics, like when Chris asked about protesters about the bust out there, the most important thing that people can do is communicate, speak their voice about what they want to have done. Those community leaders should listen to the people in their community and make decisions around that. Regarding the protest, I mean the process of historical commission and how those decisions are made, I haven't looked into that, but those community leaders themselves should engage in dialogue to understand the importance and to have conversation around those subjects that are particularly important right now.
Final question.
Governor, you had mentioned just a few minutes ago that there's good dialogue regarding the bust of General Forest. Do you eventually see that bust coming down?
As I said before, there's a process to this. I'm not entirely the person responsible for that process. I have said this, though: something should be done. That particular individual and his role in history is particularly painful to African Americans in this state, and for that reason, I think there should be a strong consideration and strong dialogue around what happens to that bust. It's been talked about for a long time, and there will be a process that determines that. It's not entirely up to me, but something should be done.
If it was entirely up to you, would you take it down?
Just like I answered Sergio a while ago, what do I think about racial reconciliation? If it were entirely up to me, I would have the appropriate, I wouldn't go based simply on my experience in my life. I would have the appropriate conversations with people to inform my decision, and then I'd make one. And that will be the process for me going forward on any of these very important subjects that we have going forward. Yes, sir.
What do you think the legislature is thinking about adding the House clerk and the Senate clerk to the Capital Commission? What do you make of that? Is that a move to blunt any effort by you for your members?
I don't know. They didn't talk to me about that. I don't know what their intention is. They didn't talk to me about it.
That's all the time we have for questions.
You talk about the bus, and I have to push on that because you haven't given like a complete answer. What would you like to do besides listening to me?
Yeah, and until I've had conversation with black leaders and with others who have an interest in it staying there, and until I engage in dialogue, which I think, again, if I've learned anything over the last 2 weeks, it's that my own experiences don't define the path forward necessarily. What's really important is that we not draw lines and choose sides. It's that we understand that these answers are complicated and they require dialogue. So what I would do is I would sit down with those who advocate keeping it. I would sit down with those who advocate getting rid of it. I would consider my own experiences and my opinion about it. That should be formed and shaped by that dialogue going forward. And I actually think it represents a very important process for making very difficult decisions that lie ahead if we're going to make progress in an area like racial reconciliation. I think one of the challenges for us in this country is that issues become divisive, and they become, and it's counterproductive to progress. And the way that we eliminate that divisiveness is to come together and have dialogue going forward on something like that.
When you talk about people from,
Did I what? I'm sorry.
you talked about we would like to hear from people who wanted to stay and people who wanted to.
Yeah.
Are you planning on meeting with people on?
I will. I will be talking to those folks going forward.
That's all the
Yep.
time we have today.
Thank you all.